podcast where we cover all things ketamine therapy and mental health, and really dive into the questions that a lot of people have, misinformation and stigmas around ketamine therapy and psychedelic therapy in general. So I am Ashlynn, your host, and we are joined by Dr. Gilmore, the medical director for Anew. He joined us on the first episode, so he should look familiar. And today we're going to cover maybe a more sensitive topic, but I think very, very important in the discussion of ketamine, and that is the tragic loss of Matthew Perry. And there is a lot of headlines and feelings and facts too, swirling around about what happened here, and what the goal is for today is to kind of walk through the official reports of what occurred, what happened, and unpack ketamine's role in all of this. I know there's a lot of patients and prospective patients that were really worried when this hit the news, and obviously a loss of life in any regard is extremely tragic. And so, today we just want to focus on the facts, what occurred, and make sure that the people listening have a good understanding of what happened. So, Nate, Dr. Gilmore, can you maybe just kind of take us to the start of the official autopsy report? What was the official investigations, or what was the official report from the authorities?
So, it's the report is fairly broad. It includes his medical history that contributed to his death, the circumstances and the environment that contributed to his death, and as well what tests they had run that also seemed to contribute. So it listed that he was found in his spa, which is part of a swimming pool area. And they documented that they feel that drowning was part of his death, but so was cardiovascular disease, and so was ketamine that was in his bloodstream. And they have a fairly decent timeline of when he was last seen and when he was found. And there was a gap of time when he was alone, or supposedly alone as far as we can tell. And then he was found dead in his spa, basically. So, that broad understanding to me as a medical practitioner means that it was a multiple things contributing to his death in that circumstance, and not just one thing. It wasn't a gunshot wound, or it wasn't an overdose, ridiculously high amount of one substance that was in the system, if that helps, set the stage for what we're talking about.
So if we look at the official report, the quote, the County of Los Angeles Department of Medical Examiner determined the cause of death of 54-year-old Matthew Langford Perry as the acute effects of ketamine. Contributing factors in Mr. Perry's death included drowning, coronary artery disease, and the effects of, I'm not going to get this right, the opioid use disorder modification.
Buprenorphine.
Thank you. The manner of death is accident. So when we say this, I guess is why you're saying, multiple contributing factors, but when they say acute effects of ketamine, what does that mean?
So this is where, the verbiage in a legal document, which is to help people understand the exact thing that tipped the scales,
okay,
is only part of the story. And in this case, ketamine was in his bloodstream, okay? And they found it as 3.54 micrograms per milliliter, which, means nothing to anybody, except that it's within the range of general anesthesia levels of ketamine. So, meaning he had enough ketamine in his bloodstream when he passed away that he could have been under general anesthesia amounts, and then it's kind of middle range, higher doses. It wasn't low dose.
So unconscious?
Effectively unconscious.
Okay.
While in a spa, apparently, and which is like a swimming pool, a hot tub type environment. So that is easy to say, well, that's too high for walking around and doing normal life. So that's going to be the immediate trigger. But in the operating room, you can have that amount in your system and be just fine because you're not in a pool.
Right.
So that's where the other contributing factors to me are a huge important thing to talk about. Obviously, there's a lot to talk about here. And it's a really sad, hard thing because everyone loves Matthew Perry and his roles and his characters and him as a person. He actually had been very transparent in his mental health and his personal life, substance abuse history, and his willingness and openness to get treatment for that, including having received ketamine treatments over the years for his depression, anxiety, and substance abuse.
So that seems to be a point of confusion because he was in fact doing ketamine therapy for substance abuse / mental health, as far as we know, with a licensed provider clinic, but his last true treatment was a week and a half prior. So are we talking about the same ketamine in his system from that appointment, or are we talking about a separate administration of ketamine?
No, the treatment that had been scheduled and has a history documented that he was getting for his mental health was not involved, had nothing to do with his death in his hot tub. The half-life of ketamine is hours, a few hours. So the treatment he received the week before was long gone out of his system. So the amount in his bloodstream when he died was into his system some other way. And that to me is the bigger question, the bigger dialogue, is that this guy had enough ketamine to be under general anesthesia in his hot tub. How did that happen?
How did you get your hands on that amount?
And why? What would lead someone to recommend it, or why would he do that without recommendation? There's just so many questions. Like this is so not a good idea. And if he weren't in the hot tub, there's a real chance he would have survived. But if you're under anesthesia in a hot tub, you're going to breathe water. So it's just
because the sensation of ketamine, and we just in our last episode talked a little bit more about what that's like. You are in an altered state of consciousness, and so your body and your mind feel separate. You don't necessarily have the ability more often than not to move. And with general anesthetic level doses, I mean, that's the whole point, right? Yep. Is that you are unable to move so that surgery, incision, whatever can be done, right?
And whatever movements you may be able to do won't be functional to swim or to pull your head out of water. You may not be able to appreciate that you're breathing water. Like you're truly so altered, your mental status is so altered that you don't know that you're drowning, or you don't know that your leg's getting cut off. So it's really unfortunate. And I'm not saying that is exactly what causes death, but someone who's found in a swimming pool with anesthesia levels of a sedative in their system, it's extremely unlikely that the patient had a adverse reaction to the medicine itself, because that medicine has been given over and over and over at higher doses for longer amounts of time without a surprise death. So to me, the circumstances and underlying other conditions are, to me, as much or more the story than the actual ketamine, including, why and how did he have it? It's a different scenario, but it reminds me a lot of the Michael Jackson situation with propofol. It's another anesthetic.
Yep.
It's very restricted in its use, even more so than ketamine. It's more dangerous in its immediate use than ketamine because it will stop your breathing on its own.
And ketamine does not.
Ketamine does not have direct respiratory suppression.
Meaning, sorry, just
clarify.
Clarify for us. What does that mean?
So ketamine does not have direct action on your breathing centers of your brain. So it will potentially accentuate or increase the effects of another medicine that might, like buprenorphine, which was in his bloodstream, that could have a little bit of breathing impact.
Okay.
So that's why they added that.
Okay.
It's a strong medicine. You don't want to mix meds too much. But if you're on say OxyContin or methadone, ketamine can impact those medicines and make them stronger. But ketamine itself does not directly suppress your breathing centers, whereas propofol does. So propofol in general is just kind of more dangerous in the immediate. You got to be more careful.
Risky, yeah.
And Michael Jackson was getting it infused at his house, basically, with unclear monitoring apparatus, unclear preparation and planning. The whole thing was just like, why would you use propofol at your house? Similarly, why would you do ketamine at your house without the right monitoring? So it just reminds me of the same scenario. The medicines are important. They're strong. They're regulated. You got to be, there's reasons why with medical practitioners to do their jobs. It's to keep you safe.
Yeah.
So I would strongly recommend to everyone to not do a bunch of ketamine at home, unmonitored, and get in your pool. That's a really dangerous thing to do.
Yeah.
And it's really unfortunate that seems to be what happened with Matthew Perry. There may be some other details that come out that help color the situation a little bit more. But he clearly had more ketamine than is safe in his system to be around a pool.
Yeah. Well, and to be completely honest, everything you're saying is not what I see in the headlines. And I don't think it's what most people see in the headlines. I think more often than not, I see the headline that says, cause of death, ketamine. Matthew Perry dead due to ketamine. Matthew Perry undergoes ketamine therapy and dies in his pool a week later, right? So why this misinformation? And why is it important that, of course in anything in life, but why is it important specifically for this that people have factually based information on what occurred here?
It's disappointing and saddening and we got to get the word out because, the irony here is Matthew Perry was a huge advocate for ketamine therapy. Mm-hmm. He knew its benefit. It had helped him over the years. Yeah. And he knew its benefit. And he had received treatments that were, as far as we can tell, monitored and careful within a facility, which is the right way to do it, the safe way to do it. So it's really unfortunate that there's an event that was well outside of recommendations, like not even remotely close to best practice, that had a misadventure, a mishap, a catastrophe, and a death. That's the issue, not the treatment that's under guidelines, under recommendations, under best practice paradigm. So it's unfortunate that there's this misunderstanding. So if anyone has any questions, please reach out to us. We can help clarify even more. There are some really good reports out there that are pretty nerdy, that are very clear, very explicit, very specific, saying there's no way that the ketamine he was getting for his mental health that was controlled and monitored and careful and the way we recommend it, that had nothing to do with his death. Mm-hmm. There was some other misadventure that was way outside the best practice.
Which at this point, until we have more information, this misadventure was likely done recreationally and illegally. I
don't want to say recreational. I mean, he might have had good intentions. He might have been trying to get a better feeling. I don't know. I mean, I don't want to ascribe why Matthew Perry did what he did, but I would strongly recommend against anybody taking a bunch of ketamine without monitoring. That's a terrible idea.
Which is not the same thing as some of these mail order ketamine options. Obviously, we're not talking about an organization that would be suggesting that, or doses that would be delivered in those amounts. But to be fair, it sounds like you do open up the same type of risk profile.
Yeah. I mean, if you order from 3 different providers and take them all at once, you could have anesthetic levels in your system.
Yeah.
So that's why the monitoring matters, and the controlled environment, the safe environment, and people that know how to administer these medications safely. So going back to propofol, like, there are regulations about who can give it and when and how your monitoring needs to be. And so you respect the propofol and you give it very carefully. Ketamine, you give it very carefully. It's a very, very safe medication, but I'm not going to do it without monitoring.
Yeah.
And
so monitoring, what does monitoring look like? And in your clinic and what that looks like, what does that entail? And the standard that you think is the bare minimum for what monitoring should look like when receiving ketamine.
So, to set the baseline, the state of Utah has a statute that I think is very reasonable. That says if you're going to be administering ketamine on site, you need to have someone who's airway competent to be in the facility. That's kind of the starting place. And that's because while ketamine doesn't cause respiratory depression on its own, doesn't make you stop breathing on its own, it can accentuate other things that would, like the OxyContin they took in the morning, or they have sleep apnea that's really, really bad. So you need someone who knows how to pay attention and to manipulate and safely care for that patient if there is a little bit of low oxygen, which means you're monitoring their oxygen. So bare minimum, you got to monitor their oxygen status, you got to monitor their heart rate and their blood pressure. And our best practice, our environment, is we have continuous monitoring because things can change from minute to minute, and you don't want to find out 30 minutes later that they had a problem 20 minutes ago. So, and different places can have a little bit different approach to that, but we felt strongly that we wanted continuous monitoring. And if we have to do something, we can, but knock on wood, it's really safe, and we're careful about it. We do a lot of pre-screening as well. If you have a lot of major medical problems, we pay close attention to that and make sure we prepare for it. One of the things regarding breathing, which is the to me, that's the biggest potential risk that's could catch up to you in a few minutes, especially with someone with sleep apnea, is we want to make sure their breathing status is prepared for. So if you have sleep apnea, we have chairs that will sit you up, so you're not laying flat and your apnea catching up to you. We also have patients come in with their CPAP machines to prevent that possibility. So we're so far on the side of cautious.
Yeah.
And other facilities might be that way too, but obviously doing it at home on your own with no one paying attention to you, or hey, I'm going to take my ketamine and go to bed.
Right. Or you're a patient with extensive trauma and not having a therapist there to be able to guide through the potential of being re-traumatized, which is a very real risk, especially for people with PTSD.
For sure.
So it sounds like, and I think what it's important that people kind of understand is that Matthew, there was a variety of things that occurred here, and all very sad, all very tragic. Some of them sound like very avoidable.
Absolutely. I mean, he got a lot of ketamine in his system before he got in his spa.
Yeah.
And how he got in his system could have been prevented for sure. And then not being in the spa could have been prevented.
Yeah.
So absolutely, this was not a medical mistake. This was...
You put powerful drugs into your system, you go into a body of water. You already have a risk of drowning with or without any medication in your body.
Absolutely.
Now you put a sedative in your system. There should be zero expectation that you're able to swim.
Absolutely right. And maybe there was a heart arrhythmia because he had so much in his system because he has cardiovascular disease, according to the coroner's report. Well, you should be under a monitor. I mean, there's just so many gaps in doing it safely that, it's terrible. It's very, very sad, but I would never be okay with a loved one of mine getting a large dose of ketamine in their system without monitoring.
Yeah. And as far as you know, has anyone in the United States died in a ketamine therapy clinic, like experience? Has this occurred?
Not from the many studies I've read. Obviously, I can't know every event in the whole United States, but from the studies that are published, they report all the adverse events, and death has never been one of them. There have been emergency department visits, there have been some nausea and some other stuff you probably talked about the other podcast, but not in the environments within a treatment facility. But
really, the crux of all of this is the intake, knowing what a patient is bringing to the table, what risks, potential contraindications, because I would imagine like severe cardio, any type of condition would be a contraindication for ketamine therapy.
Yeah, no. So intake screening, and then preparation and planning, and safe administration. So you screen out the patients who are too high risk, and some of those maybe you need to do in a hospital, literally, with
where you have all the necessary backup, whatever.
And even those, I'd probably hesitate, because if they're too sick for ketamine, then there may be not much else you can do, because it's a pretty safe drug as long as you have all the right preparations. So you screen, and then if they have something you need to prepare for, like the sleep apnea, you have the chair a little bit higher, you have oxygen available if you need it, CPAP available if you need it, you put them on the cardiac monitor, you have your oh no box ready in case something happens. But knock on wood, things shouldn't happen as long as you're screened ahead. And
these are like worst case. You're describing worst case scenarios. You're not going to show up to the clinic if you're healthy and we've done the intake and there's not going to be oxygen.
Totally.
So what we're discussing right now is
worst case scenario that I've never seen or heard of.
Yeah.
I've never seen or heard of anybody having this.
Yeah.
This is just in case.
At your clinic,
yeah.
I mean, emergency department been called?
No, never. And I've never heard of anybody having something like that.
Yeah.
It's just about preparing.
Yeah.
And so I hate to blame it on the pool, but I really think with Matthew Perry's situation, the pool was a huge contributor.
Yeah.
And or maybe he had a ton in his system. Which is just unfortunate.
Which at that point, it could have been any drug at that high of a dose in a body of water, and we could have very much had the same outcome.
Totally. Absolutely.
Yeah.
It's very unfortunate, but I hope it can be an education opportunity for everybody. And instead of blaming the ketamine treatment, say, no, ketamine was actually helping him. He just used it in a way that was way out of line.
Yeah.
And it caught him. And it's really sad.
Yeah. And I think the reason we decided to make this a topic for this episode is, you're right, it is important that the right information is out there. I know there are patients who, when disclosed that they're doing ketamine or considering doing ketamine therapy, often get critiques from close family or friends, and they're like, well, Matthew Perry died. Like, what are you thinking about? Right? Like, why would you do that? And not only is it harmful in that it's spreading misinformation, but two, when you're dealing with someone who has been struggling with their mental health for a very long time, to take the step to get help, right, and to seek treatment is huge. It takes a lot of effort. And for a lot of people, it's hard. It's one of the hardest parts of the whole process, is saying, I need help, right? And so to get to the point where you do that, and then you've got people that are in your close circle who are pushing a narrative that isn't factually true, it just makes getting help so much harder.
Totally. It's terrible. And I people will make judgments based on faulty information all the time.
Yeah.
So we want to try and help the people that want to get the right information. And I got to say, if someone's struggling that much with mental health, ketamine is like one of the only things that will make us a significant benefit fairly quickly. I mean, we're talking major improvement symptoms in a matter of weeks. And it's safe. And the alternatives don't have that thing. Like, if you want to talk about an alternative with risk, electroconvulsive therapy, ECT, has to be done under general anesthesia inside the hospital. So in terms of alternatives that could be done to help you get out of your life-threatening suicidal situation, that's way more dangerous than getting ketamine in a facility that's got the monitoring, that's got experience, and knows what they're doing. So it's really unfortunate. So spread the word, tell your friends, have them look at this podcast, review the quality reports. I mean, I think the major media outlets are doing a better job at including some nerdy stuff with the coroner, and but we should be shouting from the rooftops that his ketamine treatments for his mental health were not the cause of his death. The inappropriate use without monitoring contributed to his death.
Well, and some people will critique and say, and so I'm curious what your response is, that, well, was it the ketamine therapy treatments that created this dependency and created this environment for Matthew Perry to then go seek out, right? Which we don't have confirmation that this, to your point, was done recreationally. We could very well find out later that this was actually malpractice involved with someone, but that he created a dependence and had to then go seek out ketamine in his own ways. What is your response to that?
As far as we know, ketamine, I know it's not going to be super satisfying of an answer, but the research we have, ketamine is not dependence forming. It doesn't create a chemical dependence the way other drugs do. So narcotics like morphine and Oxycontin, oxycodone, your receptors crave it. You cannot get by without it. You will feel like garbage unless you get it. That does not happen with ketamine. So there may be psychological needs where he feels like, oh, I'm so down and out, I've got to get my ketamine now or else. That's different than chemical dependence. And they're maybe splitting hairs a little bit, but it matters because maybe what he really needed that day was a really good therapy session with his therapist.
Yeah.
Or maybe he maybe would have benefited from an IV infusion that day because he was due or something. I don't know. Or maybe he was that depressed and that bad that this was actually suicide. And I hate to say that, but it's very possible. He may have been that bad and, decided to try and end it by overdosing and then getting in a pool on purpose. Yeah. And I don't know. I really don't want to ascribe any sort of intention to what happened. But the chemistry is clear. Ketamine does not habit forming from a pharmacology standpoint. The receptors don't crave it. There may be a psychological benefit that they want to feel, which happens when you know that you're getting better and you want to keep getting better.
Yeah.
But in general, the recommendation is a series of 6 treatments, has a profound benefit on patients, profound, life-changing. And then if they feel I'm struggling about 6 months to 12 months later, research demonstrates a benefit for 1 treatment at that point. That's the best practice. That's well studied throughout the world. There's studies in Europe that show a similar benefit, and it's safe. So the Matthew Perry thing is devastating and hard and sad, but totally not related to acute treatments.
I know this is a heavier topic for sure, and I think important nonetheless that the conversation happens and encourage people that may be defaulting to the really shocking headlines that are out there to do a little bit more research and understand that there was a lot involved here, and this was an individual who also was struggling with a lot of things, substance abuse, mental health. So there was a lot of variables going on, but I think this was incredibly informative. So thank you, Dr. Gilmore, in helping us walk through what happened here, the official reports, and making sure that we're walking away with the right information and not placing stigma on a treatment that already has so much stigma. Matthew Perry aside, we spoke about this, in subsequent episodes. There's plenty of stigma already on ketamine treatments and psychedelic therapies in general, and then when this happened, just compounded that. And so doing our part to make sure that the right information is out there. So thank you so much for joining us. If anyone has any questions on this further, feel free to drop us a line. We want to make sure that people have their questions answered. If this is interesting content to you, subscribe, like our content, follow our socials. We'll be posting more episodes as the months